Hello, my name is Ashley Likens and I'm a school-based mental health therapist with Access Counseling Services. Today I'm going to be doing a presentation on bipolar disorder in children and adolescents. In this presentation, I'm going to be doing an overview of what bipolar disorder is, symptoms of bipolar disorder and what to look for in elementary, middle school, and high school age children and adolescents, interventions for each age group that can be used at home and in the classroom, and how bipolar disorder may impact children and youth in the classroom and what to look for as an educator. So what is bipolar disorder? What a lot of people may not know is that there are actually two types of bipolar disorder. According to the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, in order for an individual to meet criteria for bipolar I disorder, they must have experienced a current or past manic episode. A manic episode is a distinct period of abnormally and persistently elevated, expansive, or irritable mood and abnormally and persistently increased activity or energy lasting at least 1 week and present most of the day, nearly every day. During this period of mood disturbance and increased energy or activity, 3 or more of the following symptoms, 4 if the mood is only irritable, are present to a significant degree and represent a noticeable change from usual behavior. This can include inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual or pressure to keep talking, flight of ideas or subjective experience that thoughts are racing, distractibility, increased in goal-directed activities, and excessive involvement in activities that have a high potential for painful consequences. These symptoms must cause significant impairment in social or occupational functioning or necessitate hospitalization in more severe cases. The episode must not be a cause of physiological effects of a substance or another medical disorder. You may also see a presence of a hypomanic or a major depressive episode in bipolar I, but these are not required for diagnosis. For an individual to meet criteria for bipolar II disorder, they must meet criteria for a current or past hypomanic episode and criteria for a current or past major depressive episode. A hypomanic episode requires the same criteria as a manic episode, but the symptoms only need to be present for at least 4 consecutive days. For a major depressive episode, 5 or more of the following symptoms have to be present during the same 2-week period and represent a change from previous functioning. This includes depressed mood most of the day, nearly every day, diminished interest or pleasure in all or almost all activities most of the day, nearly every day, significant weight loss or weight gain, insomnia or hypersomnia, psychomotor agitation and retardation nearly every day observable by others, fatigue or loss of energy, feelings of worthlessness or excessive or inappropriate guilt, diminished ability to think or concentrate or indecisiveness, and recurrent thoughts of death or recurrent suicidal ideation without a plan or attempt. So these are a list of some bipolar disorder symptoms that you may see in a child or adolescent if they are in a depressive state in the classroom. This could be that the child will appear more sad most of the day, or low self-esteem, self-doubt, or feelings or fears of not being good enough, feelings of wanting to die, change in observed activity levels, so they might appear more slowed down or dragging. They may have more trouble with relationships, so for younger children, you may see that they are not playing with the same kids at recess or socially withdrawing. They may appear more tired, sleepy, or fatigued. There may be a change in their appetite, or they may be gaining weight or losing weight. You may notice a drop in energy, problems focusing or making choices, suicidal thoughts or self-destructive behaviors or statements, frequent bodily complaints such as headaches or stomach aches. This would be primarily for younger children. Sensitive to failure or rejection, especially with schoolwork, and feelings of anger, hostility, or aggression. These are some bipolar disorder symptoms that you might notice if the child or adolescent is in a manic state in the classroom. They may appear more elevated, expansive, or irritable. They may have more of an inflated self-esteem, feel really good about themselves. They may present with significant decreased need for sleep, They may be more talkative than normal or talk really fast, rapid speech. They may have racing thoughts or flight of ideas. They may be more distractible or distracted. Excessive involvement in multiple projects and activities, and in some cases, some highly risky pursuit of pleasurable activities. For example, activities involving drugs, alcohol, or sex. This is seen more in adolescents, or risky behaviors. So on the image to the left, I wanted to compare bipolar disorder and ADHD. A lot of times, bipolar disorder and ADHD overlap in symptoms with children and youth. With bipolar disorder, you're going to see more severe mood swings and rapid cycling. So this can include elation, grandiosity, racing thoughts, rapid or pressured speech, risk-taking behaviors, tantrums, aggression, rage, and low need for sleep. With ADHD, it's more the inattention and hyperactivity components, which the child or adolescent may be more distractible. They may have more anger and rage. Mood changes are a little more appropriate, and behaviors can usually be redirected. In the center here, you'll see the symptoms that overlap typically between bipolar and ADHD. This can be irritability, hyperactivity, restlessness, impulsivity, oppositional or defiant behaviors, and increased energy. To the right, I wanted to include some factors that typically affect bipolar disorder in children, and they are organized by biological, environmental, and psychological. So some biological factors are their genetics, some brain differences, their health, and any kind of inflammation. In their environment, it could be their lifestyle, any history of substance abuse, either by themselves or in their family, any traumatic events that they've experienced, and stress. And psychologically, this could be emotions, self-esteem, personality, and the strategies that they have been taught to deal with stress. So some social emotional learning in bipolar disorder. Bipolar disorder can have major impacts on children and youth in the classroom. It is imperative as educators to be able to recognize the signs and symptoms of the disorder in order to help your students in the best way possible. Often children and youth with bipolar disorder in the classroom will struggle with classwork and motivation, avoid participation in class, or be more talkative, impulsive, and distractible, have higher needs such as needing to take more breaks, visiting the nurse if they're on medication, and have meetings regularly with their school counselors, probably at least once a week. And they may need seating in the front of the classroom to avoid any type of distractibility. So, how should teachers respond in the classroom? Be patient and flexible, and recognize and praise positive behaviors. Try to set up a routine with scheduled planned and unplanned breaks. This is especially important for our younger kiddos. Encourage students to utilize their calming and coping skills during class time, such as using a stress ball or taking time to pause and take deep breaths. For younger kids, it might be a good idea to create a safe space in the classroom for them where they can go during class time if they need a break or need to calm down. This can be a small space in the corner where there's a pillow, a blanket, a snack, a book, and maybe like a stress ball. You may want to assign seats for the student that may be less distracting for them. Be more forgiving, be intentional, and communicate with the student regularly if you notice that they're struggling, or offer to assist them in any way you can. And always be sure to coordinate with a school therapist and parent regularly to ensure the best care possible for your student. So next I want to talk about some elementary age interventions. So the first intervention I want to talk about is star breathing. The star breathing intervention is a great tool to utilize with younger kiddos who struggle with bipolar disorder. This intervention focuses on body and mind regulation to assist the child in self-regulating their body and emotions. You can print off a star for each student in the class and practice this intervention daily, in the morning and at the end of the day, or just needed throughout the day or week. Teaching deep breathing skills to children helps to get more oxygen to the bloodstream and helps the body feel more relaxed, calm, and less stressed. And this can be utilized in the classroom or through remote learning. You can also find these links to star breathing on Pinterest or Google. The second intervention that I'm going to talk about is the Calm Down sensory bottle. This activity can be used in the classroom or through remote learning as well. Calm down sensory bottles can be used in various ways with children who are struggling with anger, irritability, hyperactivity, restlessness, and or dysregulation. These tools are a great way to allow children to express their emotions in healthy ways and let out any big emotions they may be experiencing. So some things you'll need are an empty water bottle, glitter glue, fine glitter, beads, and hot water, and some super glue. You will instruct each student to empty each of the contents into the bottles one at a time and then fill with warm water. Assist each child by gluing the lid shut on their bottles to prevent them from spilling. If they're at home, this would be the time that you would ask parents to assist the child with this part. Discuss with your students when and how they can use their calm down bottle as a coping skill for when they're experiencing big emotions or need to calm down and relax in the classroom. Some ways that you can use the calming down bottle is you can instruct each child when they're angry or irritable to go to a safe space and shake their bottle to shake out and let out some of that anger. Another good way is to watch the glitter fall to the bottom. This gives them time to calm down. And these are great tools that you can be putting in your safe spaces in your classrooms. So next I'll be talking about some middle school aged interventions. So the first one I'm going to talk about is My Feelings, My Needs. This is a great intervention to utilize with middle school aged youth. It can sometimes be difficult for this age group to express their emotions and needs to others, especially in the classroom. You're going to instruct the child to write down or draw their responses to each of the prompts. You can also change the emotions if needed. So if you wanted to change scared, you could use anxious instead. This can help you and the student know how to better handle big emotions if or when they come out during class and allow the student to feel heard and valued. The second intervention that I'm going to talk about for middle school age children is the emotions wheel. You will ask each student to identify 3 to 6 emotions that they have been feeling over the last week and encourage them to either draw a picture of or write out the certain things in their life that are causing those emotions for them. This is a good way to allow each student to express, understand, and process their emotions. You can either print off a template like the one I have displayed here, or you can instruct each child to draw a pie on a piece of paper. And lastly, I'm going to discuss some high school age interventions. So the first intervention I'm going to talk about is the self-esteem portrait. This can be done in the classroom or through remote learning. You're going to pass out a blank canvas picture to each student, like the example to the right. If this is done remotely, you will ask each student to draw a blank face on a piece of paper. Ask the students to think of negative thoughts or feelings they think about themselves or negative thoughts that others have said to them and instruct them to write these things on the outside of the blank canvas. Then, you will instruct each student to write the positive attributes they believe about themselves or have been told by others on the inside of the canvas. It may be helpful to print off a list of positive attributes to assist the student in identifying these. Lastly, ask the student to cross out all the negative attributes on the outside of the canvas, stating that the positive attributes cancel out the negative attributes. Instruct each student to place this canvas in their rooms, by their mirrors, or in their nightstands as a reminder of all the positive attributes about themselves when they are having a rough day or feeling down. This is important for high school students with bipolar disorder who may be struggling with low self-esteem, self-doubt, or difficulties with relationships. The second intervention that I'll be talking about for high school age students is bullet journaling. Bullet journaling is a build-it-yourself planner that is also a fun and creative way to assist youth in being more organized and track their daily tasks and/or emotions. There's no specific rules or regulations to a bullet journal, so this can help with students who often feel stressed or overwhelmed at school. Bullet journals can be used as a place for students to write down their goals, maintain a diary, track their moods, and keep track of their daily tasks. So what is needed for a bullet journal? All you need is a plain notebook, pens and pencils, and then you will encourage each student to be creative and use the journal for a relaxing outlet, whether that be tracking their emotions, writing down their goals for their future, writing or drawing their emotions, and so on. Encourage students to utilize their bullet journals at least once a day. This intervention can be helpful to high school students with bipolar disorder. They may struggle with distractibility, restlessness, and lack of organization skills. This also encourages students to express themselves in their own way and have a safe safe place to log daily to-dos, keep a daily, monthly, or weekly calendar, jot down notes, track mental health emotions, or record long and short-term goals. Thank you so much for listening to this presentation, and I hope that it was helpful. If you have any questions, please contact me. Thank you.